This frame of reference adapts a top-down approach to identify visual perceptual factors that limit an individual's daily participation, and adaptive and compensation approaches are used to facilitate engagement in meaningful occupation. It uses theories from cognition, developmental psychology, education, and Warren's developmental hierarchy of visual perceptual skills. Visual perceptual skill development is viewed to be developed from a hierarchy, starting from oculomotor control, visual fields, visual acuity. The next levels are sequential attention, scanning, pattern recognition, visual memory, visuocogntion, and eventually adaptation through vision. This frame of reference assumed that learning does not necessarily follow this hierarchy, which means that deficit in one area does not predict deficit in another area. Visual perception processing is learned and developed from experience and practice. It involves a receptive component and a cognitive component. Stimulation is necessary for children to acquire this skill. In evaluation, therapist asks and observes how visual perceptual difficulties limit occupational performance and participation, and identifies underlying influencing visual perceptual factors in the process. Visual processing involves input, processing, and output, followed by feedback, and this pattern is used when applying this frame of reference in intervention planning. Therapists can apply environmental adaptations within a visual input stage and employ techniques of remediation, strategies and environmental adaptations within a visual processing and output stages. The ultimate goal of the interventions is to facilitate children to engage in meaning, age-appropriate occupations,